Hello, Tracy, and welcome to our therapy session today. My name is John Roche, and I'm a marriage and family therapist trainee. I want to thank you for volunteering to participate in this role playing session with me. Before we begin, I want to make sure that you understand the nature of our work together and that you provide your information informed consent. Is that all right with you?
Yes, that's fine. I'm happy to participate.
Great. Let me take a few moments to explain the services I can offer you. As a trainee, I'm currently pursuing my master's degree in marriage and family therapy. I've completed extensive coursework and clinical training, and I am under the supervision of a licensed and experienced therapist. During our sessions, I will work with you to explore and address any relationship or family related issues you might be facing. This may be involved discussing communication problems, conflicts, or personal challenges, or any other concerns that you would like to bring to our sessions.
Okay, sounds good.
Okay, great. Before we proceed, I'd like to ask for your permission to record our sessions for evaluation by my supervisor. These recordings are an essential part of my training and ensure that I'm providing the best possible care to my future clients. The recordings will be securely stored and all identifying information will be removed to maintain your confidentiality. Is it all right if I record our sessions?
Yes, I'm comfortable with that.
Great. Thank you for your consent. Now let's briefly discuss the risks and benefits of therapy. Therapy can be an effective way to gain insight, find new coping strategies, and improve relationships. It provides a supportive and confidential space where you can express your thoughts and feelings openly. However, it's important to note that some therapy can sometimes bring up uncomfortable emotions or memories as we explore sensitive topics. If this happens, we can work together to navigate these challenges.
I understand.
Great. As a trainee, there are no charges for these sessions since they are for training purposes only. However, I'd like to mention that in the future, if you decide to seek therapy with a licensed professional, there may be fees associated with their services. It's always important to discuss financial matters and any concerns that you might have regarding fees with the therapist you choose to work with.
Thank you for letting me know.
Of course. Let's now discuss confidentiality and your rights as a client. It's essential to understand your rights to ensure that your privacy and well being are protected. You have the right to confidentiality. Unless there is an emergency, all therapy sessions are private and confidential. However, there are specific exceptions, such as the cases of child, elder, or dependent abuse, expressed that threats or violence towards an ascertainable victim, detailed planning or concrete signs of future suicide attempts, sharing information necessary for your treatment, and requests from legal and administrative institutions. Information sharing. With your prior written consent, I may speak to other healthcare providers or your family members in emergency situations. You can direct me to share information with specific individuals, and you can change your mind and revoke this permission at any time. Notes and records. I may keep brief notes of our therapy sessions, which are held in strict confidence. You can request a copy of these notes at any time. Informed consent. You have the right to ask questions about what to expect during therapy and the potential outcomes of therapy. Autonomy. You can decline and proceed with any specific techniques or interventions proposed during the course of therapy. And termination and continuation. You have the freedom to cease therapy at any time without facing any impediment, and you are welcome to return to therapy whenever you choose. And finally, therapist dismissal. I want to acknowledge that as the therapist, I also have the right to dismiss a client from therapy if it's determined to be in the best interest of the client's care. However, please rest assured that this decision is not taken lightly and would only be done if it's believed to be necessary for your well being.
Thank you for summarizing my rights. I appreciate knowing what I can expect and how my privacy will be protected.
Oh, of course, you're welcome. It's important for me that you feel informed and empowered throughout our sessions. Remember, these rights are in place to ensure your confidentiality, autonomy, and overall well being.
I understand, and I feel comfortable proceeding with our therapy sessions.
Oh, that's wonderful. Now that we have covered all the necessary information and obtained your informed consent, we can begin our session. As we move forward, please feel free to ask any questions, share any concerns, or let me know if there's anything specific you'd like to focus on during our time together.
Thank you. I will definitely let you know if anything comes up.
Excellent. Now let's dive into our session. Remember that our conversations will remain confidential except in specific situations we discussed earlier. I'm here to support you and work together towards your goals.